This short film is to tell you a little bit more about the outstanding work that our Allied Clinical Services Directorate does. A massively broad portfolio of services supporting patients in our hospitals but also in the communities.
Here you have the radiology department at Queen Elizabeth Hospital. Typically, radiology departments is seen to be the hub of the hospital where patients have their scans. Here is someone having their CT scan. We're keeping staff and patients safe by making sure everyone has enough PPE, including masks, they're socially distancing, and they're washing their hands regularly. So once the patient's had their scan, it is then reported. For me, as a cross-site radiologist, I'll take you through one of our scans. So here we have a CT scan of the chest, abdomen and pelvis, which typically are several hundred images that are put together on our PACS system to allow us to look through them at ease. I'm going through the chest, the abdomen and the pelvis. And we can also look at them in different planes, so front to back, as well as using different filters. So looking at the chest, we have the lungs filter, and we have a bone filter as well. What we would typically do once we've looked at the scan is tell the clinician in a report what may be wrong with the patient or what normal looks like to make a clinically relevant report.
The pharmacy department work across both sites, helping to ensure patients get the right medicine safely and at the right time, helping to improve their health and well-being. During COVID, we've been working particularly hard to keep our staff safe, and this has been through doing COVID risk assessments for our staff, so we've made sure they're personalised, making sure that staff have access to the right PPE and they know how to use it, and ensuring that they maintain good hand hygiene at all times. In pharmacy, we try and use technology to support delivery of our service as much as possible. This is a pharmacy robot. It can pick up to 20,000 items a month, and it actually has 100% picking accuracy.
I'm Kieran Devlin, Head of Podiatry and Orthotics at Lewisham and Greenwich NHS Trust. Podiatrists assess, diagnose and treat foot pathologies of the foot and lower limb. In Lewisham, we are commissioned to provide podiatry services from 6 community clinics in Lewisham, including Suite 1. At all sites, a significant portion of the patients we treat are at moderate or high risk of foot ulceration or amputation. Suite 1 also acting as our specialist centre for MSK and minor surgery services. We're also commissioned to provide the acute foot service in Suite 9 at Lewisham Hospital, where specialist podiatrists in wound care provide outpatient and inpatient services to people with complex wounds. This includes a multidisciplinary clinic working with the diabetes and vascular consultants. Importantly, some of the podiatrists working in the acute foot service also work in the community, taking lead responsibility in designated neighbourhoods for housebound patients with complex wounds.
Pathology is a diagnosis of disease disorders. It's split into 4 distinct areas: haematology, looking at blood cells; biochemistry, looking at blood fluids and other fluids; microbiology, dealing with bacteria and viruses; and cellular pathology, the study of tissue. Overall in pathology, we analyse somewhere in the region of 15 million separate tests per annum. To enable pathology to assay that amount of tests, automation is essential, as well as safe working practices during this COVID period. Here we have 2 high throughput robotic analysers that are able to test for COVID antibodies and also biochemistry analytes, up to 50 different analyses at a time.
I hope you've enjoyed learning about these services and the incredibly important role they play for our patients. Look out for the second video in this series, which will describe more of the services in Allied Clinical Services Division.